As people, we are a complex mixture of the biological, the social, the psychological, and all of these factors intervene to make us who we are. When we're dealing with illness, when we're dealing with psychiatric disorders, it's no different. We know that there are biological factors that are important in making some people more vulnerable. We know that genetic factors play a role, and part of the key activity in the centre here in Cardiff is to try and find out what those genes are that make somebody more or less vulnerable to psychiatric disorders. But we know that those, in a complex way, interact with each other and interact with psychological and social factors, these childhood life events, personality dimensions, all of these things, combine to make us who we are and combine to make some people more or less vulnerable to psychiatric disorders. So the aim of the centre is to try and understand more about that complexity. I think one of the things that we found out in the last 10 or 20 years is that, that these are really difficult topics to look at. These are really complex interactions between all these various factors, but we're really making some exciting progress, I think, down the line of understanding that more. That would differentiate some people that who believe that that science isn't going to help us in the area of mental health at all. That these things are so complex that we're never going to understand any more. I think that's the wrong attitude and the wrong approach, and I think we're making some really exciting progress, and we're doing that in a number of ways. I think the first way is to recognise that because this is so complex, because people are so different in their experiences, we need very big numbers of participants in the studies that we do, and we really seeing in recent years that we need tens of thousands of participants with a particular disorder in order to have the numbers that we need to disentangle this complexity. So there's big numbers. That's an important aspect, and that's why a lot of what we do in the centre is trying to get the help of many people, who suffer with mental health issues. The other exciting development, I think, is taking not just a one-off view, a cross-sectional approach where we interview somebody at one point of time, but we're moving more to see the need for longitudinal studies, for studies that really look at how these conditions develop through a person's life. Looking at that, the continuity between disorders that might affect people in their childhood and adolescence in adult and later years. So I think there's some real advantages about the work that we do in Cardiff. There's a real advantage, I think, that we have people here working not just on adult disorders, not on just one specific adult mental health condition like schizophrenia or bipolar disorder, but we work across different diagnostic groups, and we work across the age spectrum as well. We have people working on childhood disorders, disorders of of working age adults, and disorders of old age as well. And I think that perspective will really be an advantage going forward. The individual diagnoses that we have at the moment are our best guess at the moment. There's probably no underlying reality that those diagnoses correspond to. And in fact, if the research has told us anything to date, the research that we've done here and elsewhere around the world, is that many of the risk factors that we know for these conditions, many of the genetic factors that we know play a role, aren't specific for any one diagnostic group, that they play a role across those boundaries. So I think some of the interesting action in the future is going to be at those boundaries, actually, and working out better ways of characterising the mental ill health, and because there are some real benefits from diagnosis. Some people don't believe that diagnosis is a good thing, that it doesn't help, but I think there are some real benefits, I think, from being able to give a label to what you're experiencing, to finding support from others around with similar problems. But certainly there are some problems as well, and what we hope from the research that we do here is that we will come in the future to have more reliable, more diagnostic groupings that more reflect the underlying biological, psychological, social reality of these conditions.